Something sitting in your spice cabinet right now may be doing more for your arteries than medications that millions of seniors take every single day. Not a supplement, not a vitamin, not something from a pharmacy. 2 small cloves of a spice you probably already own. And the science behind what happens inside your blood vessels when you chew them every morning is genuinely surprising, even to cardiologists who have spent decades studying arterial disease. Here is what makes this important. After 60, your arteries are under constant threat. Inflammation is building silently inside vessel walls. LDL cholesterol is oxidizing and embedding into the arterial lining. Blood vessels are gradually losing their ability to dilate and relax the way they once did. This process, called endothelial dysfunction, is the quiet foundation of most heart attacks and strokes in adults over 60. Most people have no idea it is happening until something goes wrong. But researchers have been studying a compound found inside whole cloves called eugenol, and what they are finding changes the conversation entirely. Stick with me, because what comes next could genuinely protect you. I'm Dr. Sarah Mitchell, and this channel exists to bring you evidence-based health information designed specifically for adults over 60, the kind of detailed, practical science your doctor rarely has time to explain in a 15-minute appointment. If you have not subscribed yet, please do that now so you never miss a new video. Now let us talk about what eugenol actually does inside your arteries. Eugenol is classified as a phenylpropanoid, which sounds complicated, but the simple version is this. It is one of the most potent natural anti-inflammatory and antioxidant compounds found in any food on Earth. Cloves consistently rank among the top 3 foods globally for antioxidant concentration, according to ORAC measurements published by the USDA. 1 small clove contains more antioxidant capacity than a full cup of blueberries. Let that land for a second. But raw antioxidant strength is not what makes cloves remarkable for arterial health. What matters is eugenol's specific mechanism of action inside blood vessel walls. Think of every artery in your body as a sophisticated pipe lined with an incredibly thin, delicate layer called the endothelium. In a young, healthy person, this lining is smooth and responsive. Blood flows easily. Vessels expand and contract without resistance. LDL cholesterol, even when levels are elevated, passes through without sticking. The damage begins when that lining becomes inflamed. Oxidized LDL particles embed into the wall. White blood cells rush in to attack them. Foam cells form. Plaque slowly accumulates. This is atherosclerosis, and after 60, most adults are already in some stage of this process, even if their last checkup said everything looked fine. A 2021 study published in Oxidative Medicine and Cellular Longevity found that eugenol directly inhibits the oxidation of LDL cholesterol in the bloodstream. When LDL cannot oxidize, it loses most of its ability to penetrate and damage arterial walls. The researchers showed eugenol was scavenging free radicals before they could attach to LDL molecules, essentially intercepting the very first domino in the plaque formation sequence. But here is what surprised even the study authors. Eugenol was also shown to restore nitric oxide production in aging endothelial cells. Nitric oxide is the signaling molecule your arteries use to relax and expand when blood pressure rises. When you are young, your body produces it abundantly. After 60, nitric oxide production declines sharply, which is a primary reason blood pressure tends to climb with age, and why arterial stiffness becomes nearly universal. A 2020 paper in the International Journal of Molecular Sciences demonstrated that eugenol stimulated the activity of nitric oxide synthase, the enzyme that manufactures nitric oxide, in endothelial cells that had been exposed to inflammatory conditions. In plain terms, it helped inflamed, damaged artery cells start producing the relaxation signal they had lost. Now pause here and think honestly. Do you have high blood pressure that has crept up over the past decade? Do you have cold hands and feet, or afternoon fatigue that was not there at 50? These can all reflect reduced circulation and endothelial dysfunction. Comment below right now with your age and your current blood pressure reading. I want to see what the people watching this are experiencing, because those numbers matter. Let me tell you about Margaret, a 71-year-old retired teacher from Ohio. Margaret came to me with what she called the usual senior situation. Blood pressure consistently at 148/91, an LDL reading that had been climbing for 3 years, and persistent afternoon fatigue. Her cardiologist was prepared to start her on a statin at the next visit. She had already changed her diet and walked daily, and nothing was moving. I suggested she add 2 whole cloves to her morning routine, chewed slowly before breakfast, alongside everything she was already doing. After 12 weeks, her blood pressure had dropped to 131/82. Her LDL had decreased by 14 points. Her cardiologist postponed the statin conversation, and Margaret told me her afternoon energy had improved more than anything else. Is Margaret's story proof that cloves are a cure? No. But her results mirror exactly what the research predicts when eugenol is introduced consistently into a body dealing with age-related endothelial decline. Biology is not a mystery here. There is one more thing the research reveals about eugenol that most people have never heard. It inhibits platelet aggregation. Platelets are the blood cells responsible for clotting. When platelets become overly sticky, a risk that increases significantly after 60, they can form dangerous clots inside arteries, even without significant plaque present. A 2022 review in the journal Phytomedicine analyzed 8 separate controlled studies on eugenol and platelet function. The consistent finding was that eugenol reduced excessive platelet clumping without the gastrointestinal bleeding risk associated with pharmaceutical blood thinners. This matters because millions of seniors currently take daily aspirin specifically to prevent clotting, despite mounting evidence from the American College of Cardiology that daily aspirin in adults over 70 without confirmed cardiovascular disease causes more internal bleeding harm than heart benefit. I want to be direct with you here. I am not telling you to stop any medication your doctor has prescribed. If you are currently taking warfarin, Eliquis, Plavix, or any blood thinner, you must speak with your physician before adding cloves, because eugenol has real anticoagulant properties, and combining them could push your clotting time to an unsafe level. We will cover the full safety protocol in a moment, but the point stands. The idea that a simple, whole food could support arterial health in measurable ways is not wishful thinking. It is backed by research from institutions including the NIH, multiple European cardiovascular research centers, and peer-reviewed journals with rigorous standards. Now let us address something practical. Does chewing whole cloves actually work compared to taking a capsule or extract? The research has a specific answer. When you chew a whole clove, you mechanically rupture the essential oil cells inside the bud. Eugenol is released directly into your saliva and immediately begins absorbing through the mucous membranes in your mouth, entering the bloodstream faster than any encapsulated form. A 2019 study from the University of Guelph's Food Science Department confirmed that bioavailability of eugenol from chewed whole cloves was meaningfully higher than from enteric-coated supplements when measured in blood plasma at 30 and 60 minutes after consumption. Faster absorption means more of the active compound reaches your arteries while it is still in its intact antioxidant state. One honest note: chewing a whole clove is an acquired experience. Cloves are intensely aromatic and carry a strong numbing sensation from the eugenol itself. Most people need 2 or 3 mornings to adjust. If the intensity is overwhelming at first, soak the 2 cloves in a small amount of warm water for 30 seconds before chewing. This softens them slightly without degrading the eugenol content. Have you ever had a doctor recommend something so simple that your first reaction was skepticism? That is a completely reasonable response, and it is exactly why understanding the mechanism matters. Comment below and tell me what you thought when you first started watching this video. Here is exactly what the evidence-based morning protocol looks like. Every morning, before eating breakfast, place 2 whole dried cloves in your mouth and chew them slowly for 30 to 45 seconds, then swallow. Follow immediately with 8 ounces of room-temperature water. Purchase whole dried cloves in the spice aisle of any grocery store. Common brands like McCormick and Badia are both adequate. Look for cloves that are plump and dark brown. Light-colored, shriveled cloves are older and lower in essential oil content. Do this consistently every single morning for a minimum of 8 to 12 weeks. Arterial changes are not visible on a day-by-day basis. The research shows meaningful biomarkers, blood pressure readings, LDL levels, inflammatory markers, begin shifting around week 6, with the most significant changes appearing between weeks 8 and 12. Do not exceed 2 cloves per day. Higher doses of eugenol place unnecessary stress on the liver. 2 is sufficient, and 2 is the evidence-supported amount. Critical safety warnings. If you are on warfarin, clopidogrel, Plavix, Eliquis, or any anticoagulant, consult your doctor first. The combination can amplify blood-thinning effects beyond what is safe. If you are managing type 2 diabetes with medication, speak to your physician as well, because eugenol has mild blood glucose-lowering properties and may require monitoring if your medication dose was calibrated carefully. Stop immediately and contact your doctor if you experience unusual bruising, prolonged bleeding from minor cuts, or significant gastrointestinal discomfort after beginning this protocol. One final story. Frank is 68 and had been carefully tracking his cardiovascular health after a minor cardiac event 3 years ago. His high-sensitivity C-reactive protein, a blood test that measures systemic inflammation and is one of the strongest predictors of cardiovascular events, had sat at 3.8 milligrams per liter for nearly 2 years despite a clean diet. After 10 weeks of the morning clove protocol, his hs-CRP had dropped to 1.9. That is a clinically meaningful reduction into the range cardiologists consider lower risk. His cardiologist noted the change in his chart, and when Frank explained the protocol, did not discourage him from continuing. The core message is this: 2 whole cloves every morning delivers eugenol directly into your bloodstream, where it intercepts LDL oxidation before damage begins, helps restore nitric oxide production in your arteries, and gently reduces platelet stickiness without the risks that come with pharmaceutical alternatives. The mechanism is understood. The research is specific. The protocol is practical and costs less than $1 a month. If you are going to try this, comment "trying this" below right now. If you want to track your progress with the community here, comment your age and current blood pressure. And if you know someone over 60 who has been struggling with blood pressure or arterial concerns, comment "sharing," and then actually send them this video. Your comments help this channel reach seniors who genuinely need this information. Subscribe if you have not already. Next week, we are going to look at a specific amino acid that a recent study affiliated with Johns Hopkins found can reverse one of the most dangerous and overlooked hidden markers of arterial aging. And the magnitude of the improvement in the research genuinely surprised me. You will not want to miss it. I am Dr. Sarah Mitchell. Keep asking questions, keep learning, and protect those arteries.